All right, we'll go ahead and get started. So welcome everyone and happy Wednesday. My name is Katie Junk and I'm with Ochsner Health. Really excited to have you all here with us today as we hear more about tackling type 2 diabetes and eating for success. We're going to be led by Rachel Swanson. Rachel is a professional health coach with Ochsner Digital Medicine. She has a bachelor's in nutritional sciences and a master's in exercise science and health promotion. So Rachel will be leading our discussion and also telling us a little bit more about Ochsner Digital Medicine, which is another one of Ochsner's programs that has helped many members reach their type 2 diabetes goals as well. So thank you all. I want to mention a couple of things. We really want to make this interactive. We're excited to have you here with us today. So please, if you have any questions for Rachel throughout the presentation or even at the end, feel free to pop those into the Q&A or into the chat, and I'll be monitoring those, and we'll make sure to get your questions answered as we go through the presentation today. So without further ado, I will send it over to Rachel.
Hey, good afternoon, everyone. Like Katie said, my name is Rachel. I'm a professional health coach here at Ochsner's Digital Medicine. It's a great program. If you're not in it, I highly recommend talking with your doctor, checking it out. So basically, my role is I discuss with my patients any lifestyle modifications. So we discuss diet, exercise, stress management. So I just wanted to kind of give you guys an overview of some things that I discuss with my patients in the program. I'm going to go ahead and share my screen. All right, so we're going to go through some eating tips, some workout tips, and like Katie said, if you have any questions about anything, just pop them in that Q&A section. So type 2 diabetes, if you're not familiar with it, this is the most common form of diabetes in the United States. According to the CDC, more than 30 million Americans have some form of diabetes. So that's about 1 in 10 people. And out of those 34 million, 90 to 95% of them are type 2 diabetes. So the difference between type 1 and type 1, you're insulin dependent. You're usually going to develop that in childhood. You're kind of born with it. Type 2, we develop later on in life. Our body does produce insulin, but when you have type 2 diabetes, our body doesn't use it properly. So there's decreased sensitivity to that insulin effect. There's lower production of insulin. You don't have to be on insulin for type 2 diabetes. You can be on just a different type of medication, but you can also manage it through healthy eating and exercise. So you can really maintain that blood sugar without having to depend on the medication. And that's kind of what we're going to go through today. Some of these tips and tricks, if you are pre-diabetic or you do have type 2 diabetes, maybe you don't want to use medication, that's really what we're going to focus on today. So diet. This is our most powerful tool with type 2 diabetes. And the most important thing to remember is there is no magic diet for diabetes. You'll hear a lot of different people say, oh, well, I'm doing keto or Atkins or another low carb type of diet. You don't have to. The best way, though, to kind of figure out what you need to do with diabetes is really working with somebody who is educated in this. So whether that's a diabetes educator or a registered dietitian who has really studied diabetes and knows about it, they can give you an eating plan that's just for you. It's not going to fit anybody else per se because everyone is different, but it's going to give you an idea, a starting point of where to go. As a health coach, we aren't diabetes educators or registered dietitians. Some of us are, but we can't give you that information. So what we do is we kind of point you in that right direction of, okay, this is what you should be doing to eat for your diabetes. Let's work with this. And if you want a little bit more of a specific goal, let's get you in contact with one of these people. A great resource that I love, I use it for myself because it's just a great tool, the Diabetes Food Hub. It was put together by the American Diabetes Association. They have all sorts of recipes from breakfast, lunch, dinner, snacks. It gives you all of the nutritional information. You can filter it if you have other like disease states like kidney disease, things like that. And it puts together a grocery list for you, which I think is the coolest thing. You can make your meal for the entire week. It gives you a pre-populated list of this is everything you need from the grocery store. These are the carbs that you're going to eat for the day, the calories you're going to eat for the day. If you do follow that, it's a really great tool. So I recommend it to a lot of people, whether they have diabetes or not, because it's so helpful and can be very useful. So what are carbs? We talk about it a lot. A lot of people don't really know what a carb is, but these are the most important thing when it comes to managing that diabetes. They play a big role. Your body does need carbs. We turn that into energy. That's what our body uses to kind of keep it going. It's kind of like the gas of the body, if you will, but it is going to impact that blood sugar if you have too much or too little. So we really need to find the balance with that. And when we say carbs, there are three major types. There's going to be starches, your sugars, and your fibers. So when you look on a nutrition label, which I'll show you guys in a minute, you're going to see the term total carbohydrate. That refers to all three types of those together. So if you've done any of those low carb diets, they tell you, subtract this from the total carb and that from the total carb, and that's going to give you this and that. Really, when you have diabetes, you want to look at that total carbohydrate because we really want to focus on all the carbs that are in it. And when it comes to choosing foods that have carbs, and there's a lot you may not realize that do have it, you want to choose nutrient-dense foods. So you want kind of what we consider those whole foods. So they're rich in fiber, vitamins, minerals. They don't have a lot of added sugars and sodiums and unhealthy fats and things like that in them. So you're looking for sort of what you would find in nature: grains, fruits, vegetables, dairy, all of that stuff, trying to avoid those packaged things that can have a lot of added carbs that you may not realize are in them. So here's just an example of the different foods that fall into the carbohydrate category. Most people, I think, are kind of familiar with the starches. We all know bread's a carb, rice, crackers. A lot of people don't realize that beans and peas and lentils also fall into that. But again, that's something that we want. And you can see here on this top row, so this is a serving. 15 grams of carbs per serving is what these are. So one slice of bread is going to be about 15 grams of carbs. Most people are aiming for eating about 45 to 60 grams of carbs per meal, and then about 15 to 20 for a snack. So if you have a sandwich with 2 pieces of bread, that's already 30 carbs right there. So if you're having chips on top of that, that's going to add in some carbs. So really understanding what a serving is and how many carbs is in a serving is going to help you be able to manage that diabetes a little bit better. And when we are choosing these starches, we do want to choose things that are lower fat, lower salt, lower sugar. There's a lot on the market that has hit that kind of meets these categories. They're higher in fiber. They don't have the added salt. And you want those whole grains. So think brown rice, brown pastas, whole wheat on the label. So whole wheat tortillas, even a corn tortilla is better than a white tortilla, the white flour tortilla. And then next category, fruit. If a diet tells you to avoid fruit, I generally tell people it's probably a fad diet because we need the fruit. We need these natural, healthy things. There's a lot of fiber and vitamins and minerals in fruit. It's just knowing which ones are better than others. So a half a banana, that's going to have 15 carbohydrates in it. So if you're eating a whole banana, again, that's 30. That's 2 servings. Whereas instead of having a half of a banana, you could have a whole cup of berries, raspberries, blackberries, blueberries, anything like that. Same amount of carbs, but you're getting more bang for your buck, so to speak. You're getting a little bit more there. And you want to make sure that you're choosing that whole fruit. So if it comes down to having a half a glass of orange juice or a whole orange, choose that whole orange. It's going to give you more fiber. It's going to have the same amount of sugar and carbs and all of that, but you're going to feel fuller longer with that orange as opposed to that orange juice. And if you do choose a juice, make sure it's 100% fruit juice. So you really have to look at these labels, look at the packaging. Is it 20% juice, 60% juice? If it is, it has a lot of fillers, a lot of added sugar, a lot of things that are going to contribute to higher carbs. So make sure you're really going for that 100% there. Milk. A lot of people don't realize that milk and dairy products have carbohydrates in them. So they'll snack on cheeses all day long, or they'll snack on yogurt, not realizing that those also have carbs in them. Now, they are a little less than some of our starches and some of the fruits. They're 12 grams. Soy milk does have starches in it. So all of these milk alternatives, you really want to pay attention. Don't think because it's an almond milk or a soy or an oat, anything like that, it's not going to have the carbs. It will. So just pay attention to it. But with those, make sure you're choosing ones that are non-fat or low fat. If you do get a milk alternative, make sure it's unsweetened. So don't get a vanilla or a chocolate. Go for just the unsweetened one because, again, it's going to have less carbs in it overall. So, really paying attention. There's a lot of yogurts now, too, that are dairy-free if you need to go that route. But again, pay attention, see if there's added sugars, things that are going to kind of boost up that blood sugar overall. And then lastly, non-starchy vegetables. So your dark greens, your yellows, your oranges, all of your other vegetables, they still have carbs, but there's 5 grams of carbs per serving in those versus some of your other ones. So when it comes down to choosing a meal or a snack, you can have a half a cup of cooked broccoli, a half a cup of cooked green beans, and a half a cup of cooked carrots. And that's going to give you the same amount of carbs as 1 slice of bread. So if you want to feel fuller longer, I'd probably go for all of those veggies as opposed to 1 slice of bread. You're still getting all of those carbs in that meal, but now you're getting vitamins, you're getting minerals, you're getting fiber, you're getting all that really good stuff. And it's the same as having 1 slice of bread. So reading food labels, why do we stress this as health coaches? Why do we always bring it up? These are very important. Learning how to read and understand these food labels are going to help you make healthier choices. So if you're in the grocery or if you happen to be looking online, really just look at the different brands, look at the different flavors of things, and really kind of compare, because you'll be surprised that one company could be the same item, but the different flavor has different nutritional value. So really look at those. The first thing I want to point out is the serving size. It's always at the top. It's always going to tell you 2 things: how many servings are in that package and what a serving is. So for this food item, there's 8 servings in a package and it's 2/3 of a cup. I don't know about you guys, I can't really eyeball 2/3 of a cup, just kind of, on my own. So really measuring and weighing your food. If you have time to weigh it, that's great. If not, just measuring it out, portion it out. If it says 15 chips, just pick out 15 chips, put it in your bag and go. If it's a tablespoon, just grab the tablespoon and scoop it out. This is really going to help with that management of the carbs. If you are watching your calories as well, your sugars, your salt, all of that. So the next highlighted point, the calories. If you are watching your calories, which a lot of people are, especially if you do have a specific meal plan that you've worked with someone on, this is going to tell you how many calories are in that 1 serving. So for this food, 2/3 of a cup is 230. Again, if I'm not paying attention and I just think I'm eating 2/3 of a cup, I could be going over or I could be going under, depending on what this item is. If it's chips and I'm just eating out of the bag, chances are I'm going over. So that's going to be a lot more than 230 calories. This is why it's important to know that serving size so that you can properly keep track of your calories and what's going into your body. The next highlighted point, sodium. One of the programs that we have in the digital medicine program, in addition to the diabetes, is for hypertension. So we really do focus on that sodium. So if you are being conscious of that sodium as well, you want to pay attention to this. This is going to tell you, again, how many milligrams of sodium is in this serving. So if you're eating just the 2/3 of a cup, this is 160 milligrams. But again, if you're mindlessly eating, not paying attention, that sodium can add up pretty quickly. And then lastly is that total carbs. So this is what you really want to pay attention to if you're just kind of monitoring your carbohydrates. What are my total carbs in this? What am I getting if I eat this 2/3 of a cup? So like I mentioned, most people are going to do about 45 to 60 grams of carbs per meal. So 3 times a day, you're going to have 45 to 60. If you have snacks built in, snacks are great. You're going to have 15 to 20 per snack. So if I was eating this for a snack, this is already over my recommended grams of carbohydrates for my snack. So I'd probably want to choose something else. However, if this is going to be a part of my lunch or my breakfast, okay, I have 37. I know that I also want to add in a whole banana. So that's going to be 30. So now I'm already at 67. So I'm kind of over it for that meal. And we don't typically like to say like, oh, if I don't use it at breakfast, I get to use it at lunch. We don't like to say that because that's going to cause an increase in that blood sugar, and then you could spike down when it comes down. So we really like to say if you don't use it at that meal, you lose it for the day. So if you're at 67, you're a little bit over, but you really want to try and stay in it. So that's why we really kind of focus on the nutrition label to help people understand what they're putting in their body and what's going on with that particular food. Another great resource that we offer to our patients, or that we tell our patients about, is the diabetes plate method. So kind of, think back to your grade school days when you were in the cafeteria and they had the My Pyramid or whatever they used at your time period. This is kind of the same thing for diabetes. Take your plate, whatever size plate you're using, and you want to put half of that plate as non-starchy vegetables. So whether that's a side salad or like broccoli or green beans or carrots, whatever the case is, half of your plate should be that non-starchy vegetable. A quarter of your plate is going to be your carb food. So are you having some fruit with dinner instead of having rice? Are you having that rice? Are you doing a baked potato? What are you doing? Make it 25%. Then the other 25% should be your protein option. So here, think, either a bean or some other type of lentil or legume, fish, chicken. You want to try and limit your red meat if you need to. But any of those protein options, you want to keep it at about a quarter of the plate as well. Now, if you want to do a little bit more of the protein than the starchy food, that's great. But we really want you to incorporate those non-starchies and that protein and still a little bit of starch. And then as far as your drink, really try to aim for that water or that 0-calorie drink. So an unsweetened tea. Add in a Splenda or an Equal or a Stevia, anything like that. Don't add in the real sugar. Keep it at that 0 calories. A Crystal Light, any sort of water flavor enhancement. Add it to it because it's not going to have the calories, and it'll help you kind of get through, oh, I have to have water again. Give it a little bit of flavor. So some healthy swaps. Great resource here from the American Diabetes Association. I think this kind of stumps a lot of people because they get on that, well, I can't have chips and I can't have this, but I really want something salty. So one example, instead of having chips, go for popcorn. Make your own popcorn at home. Popcorn is a whole grain. You get to control it when you make it at home with how much salt, what's going in it. You can make sure that, it's fresh. It's not these packaged things that may have been sitting in your cupboard for a month or two or whatever the case. This is a great option. Kind of get that salty kick out of the way. Instead of cookies, go for fruit. Choose those low carb options. One thing I really like to do, I make my own dips and dressings with yogurt and seasonings. So I'll get a packet of dry ranch mix, put it into some plain non-fat Greek yogurt. That's perfect for celery or carrot sticks, or even, using the non-Greek yogurt, just traditional yogurt, so it's a little more runny, and using that as a dressing. You're really kind of controlling your carbs at that point, and you're controlling what else is going in there. It's not packaged. It doesn't have the processed sodium in it. You really can take advantage of that. Same thing, kind of like I mentioned with the water. Add in things to it. It's super easy to make an infused flavored water. Take a bottle of water, add in some berries or some mint, or if you like cucumber, put it in the fridge overnight. The next day, you've got a flavored water, and it doesn't have any added sugar. It's just the natural sugar from the fruits. And it's something that you can drink throughout the day and kind of get that fix of tricking yourself into thinking that you're having this super sugary drink. I mentioned, going for the whole wheat tortillas, whole wheat bread, do a brown rice instead of the white rice. If you do coffee, don't use cream or half and half. Do a 2% or a non-fat milk. There's a lot of non-dairy alternatives as well that are a little lower in the carbs. You kind of want to stay away from those flavored ones because they're going to have a lot of added sugar in them. So really, again, just kind of pay attention to that food label and see what's in those creamers if you use that. Instead of orange juice, because again, a serving of orange juice is 4 ounces. That's a half a cup. That's maybe about this much. It's not very much. Have a small orange. Eat that instead. You'll get the juice from the orange. You're getting fiber. You'll feel full longer. I don't know about y'all. I have a sweet tooth. Do the dark chocolate. Get a little square of dark chocolate. Pop it whenever you need it. Count the carbs. But it's a great alternative than just doing a milk chocolate, something that's a little more processed and has those added sugars in it. So again, I've kind of been touching on this. You don't need to avoid fruit. A lot of people are like, oh, I've cut out every sort of fruit. I'm only doing vegetables. I'm only doing protein. But I have these attacks where I just want ice cream because I'm not getting anything sweet. Eat the fruit. Just be mindful of what that fruit is. So kind of going back to that banana, I say it because it's one of the most common ones. You put it in cereals, things like that. Figure it out for the day. If you want a whole banana, add that into your breakfast. Just cut the carbs somewhere else. Still let yourself have that fruit. Snack on fruit in between meals. So portion out a cup of berries. That's a 15-gram snack right there. Keep that with you. Again, some fruits are going to be lower than others. So just knowing and paying attention is really going to help you there. And having these low carb options can actually help with your blood control. So a lot of the times, you eat and your blood sugar is going to spike up. And then depending on what you have, it's going to crash down. You really kind of want to keep it even. So these can help with that control and keep you from crashing and having that spike. And again, eating that whole fruit is better than drinking it. So here's just some examples that this is a resource that we send to patients so they can have a visual when they're shopping or when they're out somewhere. So raspberries, I think to me are kind of your big one here. Look at the fiber that's in a cup of raspberries, 8 grams of fiber. That's a lot of fiber. And that's a cup of raspberries. That's a lot. So if that's your snack for the day, you're getting a lot of fiber. It's 15 grams of carbohydrates. It's not a whole lot of calories. And you can munch on that in your car if you're driving from one place to another, if you're sitting at your desk, if you're in a Zoom call, anything like that. You can just pop a raspberry in your mouth. It's great. Plums as well. They're a great treat to have. Small, you can eat it on the go. Oranges, watermelon. Watermelon I really like because it has a lot of water. So a lot of people are like, I don't drink water. I don't like water, but I need to stay hydrated. We live in South Louisiana. It's hot. We need to make sure that we're hydrating. Watermelon is a great way to get in your water for the day. Eat a cup of watermelon. It's only 11 grams of carbs, and you're still getting a lot of water in your system. So if you like it, eat it. Go for it. Blueberries, strawberries, cherries, apricots, peaches. These are all great options to have. Grapes too. A lot of people think grapes are super sugary and they should stay away from it. Grab some grapes. A cup of grapes definitely keep you full in between meals. Another big one we see is cereal. So a lot of people, they're running out the door. They're pressed for time in the morning. I don't have time to make a big, breakfast to feed 5. I need something that I can grab and go. You can still have cereal. It's just being mindful of what it is. Can you have Lucky Charms and Frosted Flakes? Probably not, but you still can incorporate it into your diet. So again, those sugary processed ones can be very high in carbs and sugars. So paying attention to that food label. You also want to be mindful of what you put in it. What kind of milk are you using? Are you using that dairy alternative? Are you using a whole milk, a non-fat milk? What's the carb like? And how much are you adding in? It seems kind of tedious to measure it out, but that's really how you're going to know exactly what you're putting in your body. And also adding fruit to your cereal. Again, boost those carbs, get you to that level that you need, give you some added fiber, some added benefits in there. And then kind of touching on the sodium as well. If you are following a low sodium diet, you do want to pay attention because cereals can actually have a lot of hidden sodium in them. So you do want to pay attention to that as well. And here's some great ones that we always recommend. Cheerios, I think, are right there. They're 20 grams of carbs, 10 milligrams of sodium. I personally love it. You can do whatever you want to it. You can add fruits and nuts, if you wanted to add some nuts in there, you can really kind of build up the Cheerios to meet your needs. Same with the multigrain, a little bit more in the carbs and a lot more sodium, but it still falls within that low sodium range. So those are good options. Total, the Special Ks. And you'll notice I touched on this earlier, same company, almost identical cereal, but look at the difference in them. If they add things in like nuts, or if they have that freeze-dried fruit or anything else in it, really pay attention and don't assume that it's going to be the same as something else, because the calories are going to be different and nutritional information is going to be different. So don't expect to say, okay, well, I eat Special K regularly, I'm going to switch to the vanilla almond and it's going to be the same exact thing. There is going to be some difference there. So really kind of paying attention. And then you might be looking at the great grains. You're like, why is this on here? This is 40 grams of carbs for a serving. Well, it's got raisins, it's got dates, and it's got pecans in it. It has your added fruit. So it's got 2 different kinds of fruit in there already for you. It's got the pecans, which is going to add some fiber, add some more healthy fat in there. And that's pretty much your whole meal. Now, if you're going to 60, you could add in something else, add in a slice of toast, add in another piece of fruit, anything like that. And I should mention, a lot of the serving sizes for cereal is about a cup to a cup and a half. So it's a decent size. It's not a half a cup. It's not just a couple of flakes. You're going to get a good amount of cereal here. But again, really kind of paying attention, if the great grains, if that serving size is only 3/4 of a cup, whereas the multigrain Cheerios is a cup and a half. If you want a little bit more, maybe go for the multigrain Cheerios, but you can still incorporate it in your diet. Same with oatmeal. You can still have your oatmeal. You can still have your grits, just being mindful of choosing the right version. So I always tell people the canister of grits and oatmeal is leaps and bounds better than the packaged stuff, because it's just the oats, it's just the grits. You can add in what you want to that. All you add is water and then whatever else you want to add. So make your own flavors. If you want to make your own maple brown sugar, make sure you're portioning it out. I like to do blueberries and cinnamon in mine. Sometimes I even do a little bit of peanut butter. You can really kind of play with the oatmeal and the grits on your own, but switching to the canister is going to save you that added carbs, added sugar, things like that. So snacks, I've mentioned this before. This is another big thing. Oh, I don't snack. I only eat 2 meals a day. Snacking is bad. This diet that I follow said you're not supposed to snack. Snacks can be a part of a healthy meal plan. It allows you to eat more frequently. It allows you to feel full. And it kind of keeps you from getting to lunch and being like, oh, I'm starving. Oh, everyone is ordering a burger. I'm going to order a burger as well because I'm just so starving. Let yourself enjoy those snacks. Spread those carbs out evenly so that you're not depriving yourself of the food and you're not letting that blood sugar spike up and down and all that. So really let yourself have a snack. Don't beat yourself up over it. There's a lot of great options. So here's some snack ideas. Again, this is another resource that we send out to our patients when they ask. Snacks with 0 to 5 grams of carbs. So again, those water flavor enhancements, a lot of them are going to be 0. Some of them might creep up to 5 depending on the flavor. Peanut butter and celery, 2 teaspoons of peanut butter, some celery. You've got a pretty protein-rich snack right there. String cheese. You have one at your desk, again, in the car. A lot of people are on the go these days. They don't have time. Oh, I don't have time to eat. Keep it in your purse. Keep it in a cooler in your car. A lot of people want dessert, which is great. Again, a sweet tooth. I love dessert. Half a cup of sugar-free Jell-O. That's usually going to be the ones that are in the store already prepackaged, but you can also make your own at home. Portion it into some Tupperware or a mason jar, something like that. Have it in your fridge. You can grab and go. Bring it for lunch, bring it for a snack, have it after dinner. Handful of nuts or seeds. Make sure they're unsalted, but cashews, pecans, peanuts, anything that's unsalted that you can just kind of throw into a bag. A lot of companies now, a lot of nut companies have the little 100-calorie packs already portioned out for you, already has your nutrition information on there. So all you have to do is bring it with you and you know exactly how much you're getting. You don't have to worry about portioning it out. And then going back to that dressing that I like to make the dip I like to make with the Greek yogurt, the flavors. Bringing some carrots or celery and a little portion of your dip and having it with you in between meals is a great option. And then if you want some, again, we talk about that 15 to 20 grams per carbs for a snack. If you want something that's a little heavier, going to fill you up a little bit, small piece of fruit, 3 cups of popcorn. So making your own popcorn, 3 cups is a pretty big amount, especially if you're looking at things like chips. And a serving size for most chips is about 15. Some of them are 7. Tortilla chips, the serving size is 7, and that's going to have more carbs. So I think 3 cups of popcorn is a better deal in the long run. 7 to 8 mini rice cakes, a 4 to 6 ounce light yogurt. So again, that's kind of already the package in the grocery store is going to be that size. A mini pizza, taking a half of a whole wheat English muffin, some low fat cheese and some tomato sauce and making yourself a pizza. That's a great snack. It's definitely going to keep you full, keep you going until dinner or whatever may come next. Sugar-free pudding, again, a great dessert. You want something sweet, but you don't want to splurge. You still can have ice cream. There's a lot of options on the market now that are low carb, that are low sugar. There's frozen yogurt that you can buy in the freezer section as well. A half a cup of that is going to be 15 grams. You can still have that ice cream and still fit within your meal plan for the day. Another big thing we see, eating out. We're in Louisiana. We have a lot of great restaurants. We have a lot of things to celebrate. Eating out can be the biggest challenge for a lot of people. The one thing I want you to remember is to plan ahead. Think of it like you're going to the grocery. You make your grocery list for the week. You have all your meals planned out. Don't treat this any differently. If you know, okay, Friday, we're going for my boss's retirement party to this restaurant, look at their website. A lot of these national chains have the nutrition information available. A lot of them have apps that you can look at the food on the app, especially if you happen to be going to a drive-through. Look at the app, see what they have. Ochsner's Eat Fit app also has a lot of the local restaurants that we partnered with that have the nutrition information. So if it's a local place that doesn't have the nutrition information on their app, check out the Ochsner Eat Fit one, see if they have it there. They'll have a lot of options for you, but you can still eat out and stay within your limits. You just want to remember, order things that are going to be grilled or baked. Don't get the fried stuff. That's where you're going to have all that excess fat and carbs and salt, things like that. Choose a healthier side. Get a piece of fish, and instead of getting French fries, get a baked potato or a side salad. Something that you can look at and say, okay, I know that a baked potato is this amount of carbs. I can have this. I'll get all of the dressings on the side, your butter, your cheese, get all of that on the side so you can control what goes on to that baked potato. You already know going into it, okay, this is X amount of carbs. I can have this over this. Beverages, again, you want to go for that unsweetened iced tea, water. Add some lemon. Ask the server for some lemon or lime or some kind of fruit if they have it to add to your water to give it a little bit of flavor. Cutting your meal in half as well. Asking your server, hey, can you please portion half of this up before you even bring it to me? So that way you're only eating half, you're still enjoying it, and then you get to enjoy the other half later on. Maybe you bring it, the next day for lunch, something like that. There are definitely ways you can eat out and still stay within your carbohydrate limit for the day. So the last part, another big key here in managing the type 2 diabetes is fitness. A lot of people are scared by this. We're not asking you to run a marathon. We just want you to move. You can start slowly. There is no such thing as going too slow with physical activity. But what you really want to do is find what you are passionate about. If you're not a runner, don't try to run. We don't want you doing something that you're going to get a week into and you're like, I hate this. I don't want to do it. This isn't for me. Why did I sign up for this? Do something that you love. People don't realize gardening, yard work, that's a great way to get in your physical activity. I have a patient who every hour she gets up and walks 250 steps around her house. She doesn't have to leave her house. She doesn't have to do anything. She just has a reminder on her watch at the top of every hour. She gets up and she doesn't sit down until she hits 250 steps. She walks to the kitchen, to her bedroom, to the bathroom. I think that's a great way. You're getting up, you're getting moving, you're getting little bits of activity in without having to dedicate too much time to it. We do want you to remember a couple of things. Again, we can give you suggestions. We can't write you an exercise plan like a personal trainer would. But we really do want you, especially if you have anything wrong with you, to talk to your doctor before you start anything strenuous. If you have underlying conditions, if you've had any sort of like knee or hip replacement, anything that could hinder you, just clear it with your doctor to make sure. But really, like I said, you can't start too slowly. So even if it's just walking, go with that. Figure out how much time per day you want to devote to this exercise. You don't have to block out an hour a day if you don't have that time. You can block out 5 or 10-minute increments. If you say, okay, 10 minutes in the morning, I'm going to walk around my neighborhood. 10 minutes at lunch, I'm going to do the stairs at work. 10 minutes after dinner, I'm going to do a yoga video. That's 30 minutes of physical activity in your day broken up. How easy is that? You really can incorporate it without having to dedicate that solid amount of time to it. I also like to have people set goals. It's just more motivating. It kind of keeps you focused. It really gives you sort of that end point. So is your goal to lose 10 pounds? Is your goal to be able to walk around the block without getting shortness of breath? What is your goal? What do you want to do? Because what you want to do is a lot different from what I want to do. So I can tell you all day long, well, my goal is to run 3 more marathons before my birthday. That's not going to help you. If I'm giving you advice on that, what good is that going to do when you're like, I hate running. I'm never going to run that far. So really figuring out what works for you and setting that goal. And consider where you're working out to. COVID's still, running rampant. You're probably not comfortable in the gym or going to a studio, and that's perfectly fine. Maybe you're just walking around your neighborhood. Maybe you have a bike and you're going for bike rides. There's a park near the house. Do that. Maybe you don't feel comfortable leaving the house at all. YouTube has a lot of free resources that you can use. I found walking videos for inside on YouTube. There's yoga, there's Pilates, there's interval stuff. You can find videos from 5 minutes to 2 hours long and everything in between that is going to help you meet your goal and your fitness. So, don't be afraid to use these resources. There's a ton of apps now. A lot of them have ads. Use those ads as your water break or your rest break. Do your 10 minutes, let it play an ad, and then start over again. And also, building those different activities into your daily routine. So kind of like I said with the yard work. If you're doing yard work on a Saturday, maybe it takes you an hour. There's your hour of physical activity. You're mowing the lawn, you're bending down to pick things up, you're raking, you're gardening. It's a lot going on. But maybe you haven't had such a productive day. You're like, how can I squeeze some stuff in? Little things, parking farther away at the grocery store to walk in, taking the stairs instead of the elevator or the escalator, getting up at work and walking around the office to go get, some water or something like that. Kind of just being more conscious of getting your steps in or getting that movement going can really help you build it into your routine daily. And again, like I said, start slowly, allow for recovery time. You want to listen to your body. If you're hurting, if you did something today that's really kind of hurting you tomorrow, take a day off. Let yourself have these rest days. If you're the kind of person, though, that is like, oh, I can't rest. I feel like I'm not doing anything. Do an active rest day. So if you're riding your bike Monday, Wednesday, Friday, Tuesday, Thursday, do some yoga, go for a walk, do some stretching, something that'll keep you active, but it's not going to, interfere. It's not going to, it's not going to get that heart rate up as much. So you're still resting, but you're still moving. And then keep track of what you do. So whether that's talking with a coworker and letting them kind of be your motivation, letting them really help you stay focused, whether it's a journal or an app, keep your eyes on the prize here. If your goal is to fit into an outfit that you haven't worn in 3 years, every month, try on the outfit and see if you're getting closer. Really, use that as that motivation and to keep you focused on those goals so that you know what's going on. And really, that's all I had. Katie, did we have any questions or anything I can answer? Oh, Katie, I can't hear you.
When you were talking about making some of those healthy swaps about, making sure we're switching to whole wheat tortillas and things of that nature, can you talk about why those swaps are important? Is it the fiber component of those foods?
Yeah, absolutely. So things like the whole wheat bread and the whole wheat tortillas as opposed to the flours, or the brown rice versus the white rice. The whole wheat items are going to be less processed. So they're still going to have more of the fiber in them. The calories probably not going to be too much different. There's just maybe a couple here or there, but really it's that fiber and less starch, less sugars in it. So it's going to be, same food item, just a little bit more nutrient dense than the white flour tortilla, the white rice, the white pasta, things like that.
Perfect. We have another question. So I know it said, I know it's not recommended, but I prefer whole milk. How many carbs are in full fat milk? And then they said, I drink it in moderation, I swear.
It should be 12 in the whole fat milk. I believe it's still the same. Really, the difference there is going to be that fat and the calories. So I really would try to limit it to just that serving size. It's usually not recommended only because, again, it has more fat and more calories than we typically need as we get older.
And Rachel, I know, you talked a lot about your patients and the digital medicine program and how you help them with things. Can you talk a little bit more about the digital medicine program and how it does help patients that do have type 2 diabetes?
Absolutely. So like I said, we don't prescribe meal plans. We don't prescribe fitness plans. We're sort of your accountability coach, if you will. We give you suggestions. I've shown you the resources. We send you resources. I call my panel of patients, and we don't call every day. We check in with you anywhere from about 4 weeks to 12 weeks, just depending on your preference, what you have going on, what those numbers are looking like. So in the diabetes program, we're looking at your A1C. So if you're super controlled there, we're looking at your A1C, we're looking at your blood sugars. We might not need to check in with you as often. You might want a little bit more of a hands-off approach. Whereas if you're still kind of trying to get a control of all of that, you might want check-ins every 2 weeks, and that's perfectly fine. Just let us know what your preference is. But what we do on those calls is we check in with you. We ask you, okay, I saw your blood sugars have been trending down recently. Your A1C came down. What's been working for you? Tell me what you've been working on. And I really, I like to get to know, did you join gym? Did you change up your diet? What happened? What really kind of clicked for you? Or where are you struggling? A lot of times the stress can add to this. A lot of us were just evacuated for 2+ weeks. Our food was not what we're normally eating. Our exercise was thrown off. So if I'm checking in with you right now, just be honest with me. Let me know, hey, I was evacuated. I didn't have any idea what I should be eating. And that's when I would kind of suggest, hey, we have these great resources on eating out. If this happens again, is it okay if I send you this so that you're a little bit more prepared? Or what can I do to help if we get into this situation again? So we're really kind of here for that accountability. We're your sounding board. What do you want to work on? What are you struggling with? We really do want to help you with this.
Perfect. Rachel, we did have a few more questions.
Yeah.
One says, it's frustrating and overwhelming to compare products with all the market labels, no sugar added, 100% whole wheat, but then labels indicate otherwise. How do you stay motivated to find the better products?
Oh, it's honestly kind of trial and error. If you find one that is kind of meets these goals, try and stick with it. But again, that's where I tend to stay away from these products that are packaged. So if I can make my own dip or I can make my own dressing, I try to do that because then I'm in control of what goes into it. The same with the Jell-O and the pudding. I love making the pudding, and just making it from the box, portioning it out so that I know, okay, this is my half a cup. I've read the nutrition label from the milk and from the pudding. That's what's in it. It's not processed. It doesn't have anything else. Because it's very overwhelming with the no sugar added versus low sugar versus no sugar, because those words are tricky. So really trying to find something that you know is truthful and you know that it doesn't have that sugar in it, and sticking to that, or trying to make your own version. It's very hard to navigate, but then also, looking before you go. So if you happen to shop at, let's say, Walmart, go on their website, type in, if you're looking for, let's say, a low sugar candy, type it in, see what they have, compare those nutrition labels. That way you don't feel rushed in the grocery store. There's people on the aisles, they're trying to get by you and you're like, oh, I'm sitting here looking at this. Do it on your own time and really sort of find what works for you. That's going to be a great way to kind of already, go in there knowing what you're looking for in an item.
Perfect. We have a couple more questions. One's a little on the clinical side, but I will throw it out there. It could be something that person should talk to their provider about. But they were recently diagnosed with hypoglycemia. Is there a big difference in the diet for someone with hypo versus hyperglycemia?
So that is going to be a little bit more of a question for like a diabetes educator or a registered dietitian, but hypoglycemia is your blood sugar is always low. So you want to get it up. So they may prescribe to you a few more carbs. But again, we usually don't deal with that. But they'll probably prescribe you a few more and just have you keep track of it that way.
Perfect. But yeah, something to certainly follow up with the educator or your provider.
Right. Absolutely.
Couple more questions. Someone asked about snacking on walnuts. How do you feel about snacking on walnuts? Is that a good snack?
Yeah, absolutely. Kind of touching back on one of the slides we had before on the snack slide, just make sure you're paying attention to the serving size, and make sure it's not salted if you are watching your sodium as well, because a lot of these, they come salted or they come coated in candied something or other. So really just making sure that you're picking like the just plain walnuts is going to be a great option. Most nuts, I think the serving size is around 3 tablespoons. So because walnuts are a little bit bigger, you may look at it and think I'm eating 10 and that's my serving size, but it's got that healthy fat. It's got some fiber. It's going to help keep you full. But if it's, on the lower end of carbs, add some string cheese to it. Add something else to it that'll help you feel full, but it's also staying within that snack carb range.
Perfect. And then Rachel, we had another question, which I'm happy to take. John asked, how do we get involved in your digital program? You can certainly talk to your provider. You can also visit, and Rachel, if you want to go to the last slide, Ochsner.org/type2. If you visit there, that's one of our website pages that has some great information. There's also a link there to our sign-up portal. So if you're interested in getting started, that's a great first place to go. That'll help you kind of sign up if you're interested, or even just learn more about our digital program. Perfect. I'm trying to see if we have any other questions before we go today. If you guys want more great content, we are on Twitter at OchsnerDigMed. And then once again, if you want to hear get some more information on our digital programs and how, we are helping patients that do have type 2 diabetes, get some of this great support, these lifestyle factors or support that Rachel does provide to her patients. Ochsner.org type 2 is a great place to get started. We will send out a link to the recording. So tomorrow, make sure to check your email if you're interested in getting a link to the presentation. We will share that recording with everyone so that you are able to see Rachel's slides again. And then we'll also include a link to some of those healthy lower carbohydrate snacks that Rachel showed today. We'll include a link in that as well in that email. So not only will you get a link to the recording, but you'll also get a link to some of those helpful resources too. I'll give a last call for questions if anyone has anything else. I think we touched all of them. All right. Well, guys, thanks so much for joining us. We really enjoyed everyone coming on and sharing more information, not only about our digital programs, but also about ways we can be eating for success when we have type 2 diabetes. So, all right, Rachel, thank you so much.
Thank you, Katie. Thank you, everyone.
Talk to you soon.